Hi everyone, my name is Twinkle and welcome back to my YouTube channel. In today's video, I'm going to be discussing about the medicals, all the medical forms, the different kind of medical tests and procedures that you are supposed to go under or before, during and after your employment. If you're someone who's planning to join Emirates, then this video is for you. In this video, I will share the medical forms in detail with you and help you understand whether you are going to face a problem or not. So if you're interested, keep on watching. What you can see on the screen now is a medical form by Emirates, and these are the few tests that are required for you to undergo. You should clear these tests. Here it is clearly written to what extent is it acceptable and to what extent it is not acceptable, which gives you quite an insight and helps you make a decision and an understanding whether you will face a problem or you may or may not face a problem. Having said that, I would like to say that the final decisions lie in the hands of company doctors and the company itself. It's a joint decision of them both, and nobody other than that can give you a proper response. Nobody is responsible to tell you that you will make it or not. So you cannot conclude everything to the T. So yesterday itself, I did a poll on my Instagram asking you if you had any questions specific to Emirates Medicals. For example, any specific concern that you have regarding a medical condition, be it teeth, be it hemoglobin, etc, etc. And yes, I got a few questions and I'm going to include that also in my video. If you are not on my Instagram, you're not still following me on my Instagram, then I'll leave the link for that in my description box. Go ahead and follow me. I share a lot of things on my stories, and you should be there if you want to keep yourself updated with airline and aviation updates. Right. So the most basic question which I was asked was first is payment for medicals. Who is going to be taking care of the expenditure of these medicals? So if these medicals are conducted in your own country, before traveling to Dubai, Doha, whatever, whichever airline you are going for, you will be taking care of that, irrespective whether you make it to the airline or you do not, right? But any other medicals that is done once you travel to Dubai, that will be taken care by the company. So be rest assured, right? Also, a big disclaimer: if there is anything that you hide, right, you deliberately hide from the recruiters, from the employers, from the company, then at a later stage they will definitely get to know about it, because there will be an extensive medicals which will be conducted by the employer, right, and by the country as per the rules and regulations. So in that case, your employment, your offer letter will be revoked, and you will have to take care of whatever expenses to go back to your own country, right? So there are consequences. Never do that, right? Keep things clear. Lot of questions on burns, scars, acne will be covered. A lot of questions on teeth. So I want to make something very, very clear first, guys. You are signing up for an industry, for a role specifically of cabin crew that has a lot to do with the image of the company, right? And you are the brand ambassadors for any airline. People look at you, customers look at you worldwide, and then they decide what kind of an airline is it and what kind of an image, what is the brand value like, right? So you have to understand the fact that your appearance here matters a lot. So questions based on the appearance of scars or acne or moles or gaps in the teeth are very, very subjective, right? And you shouldn't be even involved in the negative thinking of why, because of the fact that you're choosing this industry. Yes, everything is not based only on looks, but it is a major part. It is a vital part in your selection. So let's discuss the form now. Here are a few conditions, and they are in depth discussed to help you understand if at all there's going to be some problem or not, and if you have to work on them beginning now, you can. Disclaimer is that the cabin staff, these are the requirements for the cabin staff, specifically for cabin crew, and these are the requirements that you must meet as per Emirates requirements and the cabin crew medical standards of GCAA, right, which you need to comply with. So let's first talk about the arm reach. So minimum arm reach of 212 cms on tip toes should be there, right, irrespective of your height. So you must have seen that in the Middle East airlines, some of them would tell you to have a minimum height criteria that you should be 160, 158, 162, whatever it is. But here, minimum arm reach of 212 on tip toes is important. And this is just for cabin crew, does not apply for any other customer service agent recruits, right? That is not valid for them. So yes, arm reach should be there irrespective of whatever your height is. Coming back to now body mass index, BMI. So if your BMI is between 16 to 18, it is permissible if the body frame is proportionate, right? And the BMI from 25 to 28 is permissible if the abdominal circumference, right, is within the non-obese limits. So there are a lot of nationalities. You're going to be working with a multicultural environment in a with different sort of nationalities and ethnicities. So there are a few ethnicities, or there are a few nationalities, their body frame is petite as compared to some of them are broader. So depending on that, there cannot be one rule justified for all kind of a response to everybody. There is rules, and you can be accepted as far as your body frame, you look proportionate, right? So yes, there can be different kinds of exceptions as well. But what is unacceptable is your BMI less than 16 and over 28. That is not acceptable. Let's now get to the vision part, right? It is acceptable if your distant visual acuity. So guys, there will be a lot of terms now that will be totally medical based, right? And that can only be confirmed by a medical practitioner. So if you have any doubts on what is this or what is that, Google is your best friend, or you can get to your doctors and ask them, show them these requirements, and they will help you better, right? Since they will be able to judge you personally and they are evaluating personally, so they will know better, right? So yes, with or without correction is 6/9 or better in the better eye. Near visual acuity with or without correction is at least N5 at 30-35 cm and N14 at 100 cm. You better get these an explanation of these details from your doctor. If visual correction is required, take a note. Must be able to use contact lenses suitable for long-term wear. So you all know that aircraft is the dry area, right? It is the most dry area that you can be around, and you're going to have problems wearing lenses. So a personal recommendation from me, try good quality lenses. I have personally used lenses on as longest sectors. I was personally using lenses for all this while. After my schooling, I've been using lenses for the longest time ever. It does not create a problem, but I would always say that you have your drops, eye drops, or your lens solution to keep yourself fresh, because they tend to get drier considering the conditions in the aircraft. So yes, you must be aware of all this. Soft permeable lenses are preferable, and hard lenses, for example, there is a condition called keratoconus. You must Google about it, because then the video is going to go really long. So keratoconus is another condition where you're supposed to customize your lenses, and they are hard lenses, and that is supposed to be worn at all times. That are not suitable. So hard lenses will not be permissible, as well as they are not suitable. So if you have a condition like that, you might have problems. Unacceptable is spectacles for visual correction is unacceptable. Visual field defects, functionally monocular vision is unacceptable. Let's talk about the laser part, LASIK or PRK. It is acceptable with a full report from an ophthalmologist showing stable vision with no complications and no active treatment, and within the vision standards. Ophthalmology acceptable if well controlled allergic conjunctivitis. So it is acceptable conjunctivitis, but it should be well controlled if you have an allergic conjunctivitis. Unacceptable if you have a significant eye pathology, any progressive conditions, right? Talking about the ENT, ear, nose and throat, acceptable well controlled allergic rhinitis. This is something that is active on me. So rhinitis is a condition that aggravates through pollens or dusts or just happens seasonally to me. So it was well controlled. The only problem was that in some seasons it used to give me fever, and throat condition used to get worse. I used to lose my voice, like it used to get worse, literally worse. So in that conditions it might not be acceptable. However, if it is well controlled, there is no problem, to be honest, because I've experienced this myself. Or even sinusitis on aviation approved medications, it's fine, so acceptable, no problems with that. What is unacceptable is recurrent otitis media or tympanic membrane eardrum perforations. This is something that is common. So if any one of you has problems with eardrum perforations, you might want to check this, right? You might have to go through some problems because it is unacceptable. Yeah. Otosclerosis, Meniere's disease, spontaneous or positional nystagmus, cholesteatoma, perilimb fistula, severe motion sickness, any ear disease or condition that may cause vertigo or a disturbance of speech or equilibrium, severe hearing loss. These are some things which are unacceptable. You can see a chart. Hearing test is conducted there as well. So pure tone audiometric test which is done is unaided with thresholds no worse than, you have a few degrees here, you can very well go ahead and refer to these. Acceptable alternative tests if hearing loss is greater than the above. So it is acceptable if hearing performance in each ear against background noise simulating flight desk noise is normal for speech and beacon signals, and can hear conversational voice in a quiet room with back turned to examiner at a distance of 2 meters using both ears. These are exactly the tests that we go through. When I had to go through ENT tests in Qatar, we did something of this sort. So this is medical language. If at all you want to refer this, you want to take this to your medical doctors, please take a screenshot and by all means go ahead and talk to them about this. Speech defects, right? Stammering, slurry speech defects, sluttering, stammering is definitely not allowed. So there is no two questions or no two thoughts about this. Let's talk about the blood pressure. So unacceptable is untreated or uninvestigated recurrent BB readings of greater than 140 by 90, right? Something about that. Hypertension well controlled on aviation approved medications is acceptable. Cardiovascular unacceptable conditions are history or diagnosis of any significant functional or structural abnormality of the circulatory system, angina pectoris or myocardial infarction, coronary heart disease that has been treated or if untreated that has been symptomatic or clinically significant, permanent cardiac pacemaker, heart replacement, any abnormality of the heart, congenital or acquired, which is likely to interfere with the safe exercise of cabin duties. Some things, some conditions which are absolutely not acceptable. Hematology unacceptable is unexplained or severe anemia. So hemoglobin less than equal to 10 is not acceptable. Significant localized and generalized enlargement of the lymphatic glands and diseases of the blood that are likely to affect the safe exercise of cabin duties. Respiratory acceptable is well controlled asthma. So well controlled asthma in limits is acceptable. Unacceptable is when any acute disability of the lungs or any active disease of the structure of lungs, chest or lung cavities. So it is unacceptable if there is any acute disability of the lungs or any active disease of the structure of the lungs, swelling, scars, chest, or there are lung cavities. It is unacceptable. We're going to also talk about TB under the infectious disease. Unacceptable gastrointestinal conditions. So IBS, irritable bowel syndrome or disease, except if well controlled as per approved medications, aviation approved medications, or causing minimal symptoms. Inflammatory bowel disease, untreated hernias, gallstones. Right, a lot of you have asked me about gallstones, unacceptable. Any disease with significant impairment of function of the gastrointestinal tract. Gastritis is something else that is acceptable, but gastrointestinal conditions like these are unacceptable. Gynecology, significant menstrual pain right? So there were so many questions about what about period pain, can we fly, what does the company do for us. So if you have crampy periods and significant menstrual pain, that it is unacceptable, right? Untreated high grade pap abnormalities. So pap test is something common, the ladies might be knowing it. If you're not aware, talk to your gynecologist about it. So if there are abnormalities such as CIN2 or higher, unacceptable. Renal conditions, history of any current renal stones is unacceptable. Endocrine, unacceptable is diabetes or impairment of glucose regulation or any uncontrolled endocrine disorders such as thyroid, pituitary, ovary or adrenal gland disease. Uncontrolled is the word which is highlighted here. These are topics which need a lot of insight, and I'm sure you know that these things are very, very subjective as per the different cases. So this one paper or one line can definitely not talk about all the cases, diabetes type 1, type 2, the level of control. So psychiatric unacceptable are the history of diagnosis of depression requiring medication or recurrent depression. So this is something very interesting, right? We have an evaluation, right? And we have a session of a talk with one of the doctors that's going to evaluate your psychiatric level or your understanding. They ask you a few questions about your backgrounds, and it includes questions about suicide attempts, or if you have any scars, or if you have the thoughts of depression or alcohol intake. These are the sort of questions they will be evaluating you on, your body language and your questions, your thought process. So yes, that is a test that is conducted once you go to that country, wherever you're applying for. So psychiatric evaluation or psychiatric history or diagnosis of depression, bipolar disorder, anxiety, including claustrophobia. Now this is very, very obvious. You are going to be in an aircraft, and claustrophobia is the last thing that you want to be dealing with. Any personality disorder, psychosis, or any psychiatric abnormality or neurosis of a significant degree that may jeopardize flight safety. Now that may jeopardize flight safety is a wider term, and the conditions that are relevant may be many and their levels could be different, but these are definitely psychiatric findings are one thing that can lessen your chances. So be aware and very, very aware of what you're going to answer whenever you are asked a question based on your background or your thoughts about a few things. Remember, you're going to be evaluated by a psychologist or psychiatrist. Oh, I know this form is getting long. Then this is what you've been requesting me for. So just another form that talks about substance abuse. So these are a few things which is unacceptable. History or diagnosis of any chemical or substance misuse disorder. Substance includes, take a note, alcohol and other drugs, sedatives, hypnotics, anxiolytics, marijuana, cocaine, opioids, and so on, etc. These type of other psychoactive drugs or chemicals. If there is a diagnosis of any of these or there is a history, then it's a big no-no. The applicant will be subject to an initial and random drug screening while employed by Emirates as mandated by GCAA. Okay, these are the rules by the government. Candidates should also avoid taking any sleeping tablets or cold remedies in the week prior to arrival for Dubai. So yes, there are some cough syrups, or there could be some remedies or medications that you might be taking. I don't know if there are home remedies or rituals, whatever you perform, but make sure that you do not indulge in getting so, because it will just show. So at least a week prior to arrival to Dubai, from the commencement of your employment, you should stop. You should just avoid taking any. Neurology unacceptable is epilepsy. So there were questions about people asking me if we had a history of epilepsy. So if I read, this doesn't really state about current or a history. However, I do think that there can be problems if you have a history of epilepsy. Migraines, unexplained disturbance of consciousness, unexplained transient loss of control of nervous systems, any progressive conditions, any disease of nervous system or abnormality that may jeopardize flight safety. Recurrent vasovagal or fainting attacks are also unacceptable. Musculoskeletal conditions which are unacceptable is chronic or recurrent back pain resulting in sick leave or time off work. This is very important, guys. So if you're someone who has back pain, there will be a test that will be conducted, and if your scoliosis degree is greater than equal to 30 degrees, then it is unacceptable, right? So there are degrees. If it's not 0, then what degree is it? And if it is on the acceptable range, this is what it is. And if it is higher, you might be worried. You have to be worried. Okay, skin acceptable conditions are well-controlled eczema, psoriasis, or acne. Now, so many questions about acne scars. So, acceptable. They are acceptable as per the medical forms. But there is also something that I explained to you a few minutes back, was the image part. And the image and the visibility and or how presentable it looks is very subjective, dependent upon the employers also. Yes, it is acceptable if it is recurrent, but you have to take care of it. It should be controlled, right? Shouldn't be covering a very large surface area, and of course depends on what kind of acne do you have. Also, eczema and psoriasis depends. It should be well controlled, and the degree or the amount or the range that is acceptable depends upon the employer. Infectious diseases unacceptable is untreated or active TB. So there were some of you who were asking me about history of tuberculosis, but now they are fine. Will they be able to notice it? So this is an important part for them. Untreated or active TB is definitely not acceptable. It is not possible to obtain a UAE visa if there is scarring seen on a chest X-ray from the previously treated or active TB. So very well explained. You will not be able to get a UAE visa if there is scarring seen from the chest X-ray from previously treated or active TB, right? So there can be problems. Cases of latent inactive TB diagnosed by positive skin test with normal chest X-ray requires 6 months of drug treatment as per WHO protocol. Emirates will accept you once a medical certificate is provided by the certifying doctor that states that the treatment has been completed. So this is a good news. You might want to go through this in case you're someone who has active symptoms. Salmonella or Campylobacter carrier, HIV positive, hepatitis B surface antigen positive. This is only applicable for cabin crew. VDRL positive, any infection that may interfere with flight safety. Malignancy, so any recurrent or ongoing malignancies, you are advisable to EK clinic. A prior history of malignancy including any skin cancer, so this is relevant to your cells. If any of that, if there is any history of the same, it might be unacceptable. Yes, sleep disorders are unacceptable, which are any history or any condition affecting sleep, including obstructive sleep apnea, restless leg syndrome, etc., are unacceptable. You know that it is a flight attendant in this job role. Your shifts are not fixed, and your schedule and your roster is all haywire. It is ever changing, and you need to be well rested to be able to perform your duties well, taking into consideration you are responsible to safety of hundreds of passengers every day. So yes, this is one of the aspects which is very, very important. Yeah, that is all about it. We have discussed most of the conditions that was mentioned here. Apart from that, there is another piece of important information that needs to be read carefully before completing the attached declaration. So there are mandatory UAE government medical examinations. Few medicals that are a part of the UAE government mandatory residency visa process. These are the tests that you will have to take care of after your arrival into Dubai to determine your fitness for a UAE residence visa. So there will be blood test for HIV, VDRL, hepatitis B, chest X-ray for TB. That will be there. A UAE visa will not be issued for untreated syphilis. If you test positive for HIV, scarring from previous TB on chest X-ray, signs of active TB, positive hepatitis B surface antigen, hepatitis B, positive hepatitis B surface antigen. So TB is acceptable if treated and a chest X-ray is clear and free from scarring. However, documentation must be presented showing a course of treatment that has been completed, which we discussed while we were discussing about the infectious diseases. So what they also recommend you is that you undertake testing for HIV, VDRL and a chest X-ray in your home country prior to joining, as because a failure to meet these requirements means a failure of UAE visa requirements that will lead to the termination duration of your contract, and repatriation at your own expense, which I discussed in the beginning of the video. So if there is any pre-existing medical condition which is defined below, identified on joining and confirmed during employment, are excluded from company medical insurance scheme for a period of 2 years from the date of entry into the scheme. So if there is any pre-existing medical condition which is defined as any illness or disease or injury for which you have received a medication advice or treatment, anything before joining, and you have experienced symptoms or have become aware or have a knowledge of whether the condition has been diagnosed or not before the start of your current continuous period of cover, and the company will only reimburse any costs for the treatment of pre-existing conditions undertaken after the waiting period, which is of 2 years, right? So following the waiting period, the conditions will be covered with terms of policy and within the policy sublimit specified. If you are aware of any pre-existing medical conditions which could be excluded, so regardless of whether the company has issued a waiver or exclusion for such a condition, it is recommended that you continue your existing medical insurance cover. And there is this form that you need to sign, that you confirm and you've read and understood the information regarding to the pre-existing and mandatory UAE government medical examination, which you need to sign as a part of the documents that you'll be submitting before you go to the country and you start your process. I hope that this video helps you understand the medical requirements and what all medical problems, medical conditions may or may not cause a problem or an issue in your employment journey to joining Emirates. If that is the case, and if this video has helped you in any way, do not hesitate to like and share this video. And also, if you haven't subscribed to my channel yet, then go ahead and subscribe the channel. If there are any questions, you know the drill, put it down in the comment section below. I will see you in my next video. Till then, take care and bye bye.